The Vancouver Island Health Authority is reviewing how it handles patient information following an A News investigation. We first told you last night how VHA has been faxing sensitive health files to a Langford roofer and how the businessman has been trying to stop those faxes for 10 years now. VHA is investigating, but says until our story aired last night, it did not know the extent of the privacy breach. And Stephen Andrew reports tonight that VHA is now taking a closer look after A News uncovered more files sent to the wrong number.
For 10 years, the phone at this Victoria home has been ringing.
Hello?
And on the other end, nothing but an annoying fax tone. Sherry Kirkvold says most of the calls are coming from the Vancouver Island Health Authority.
They can happen at any time of day, and in particular, if they come from the hospital, they will program their machines to send out faxes to doctors at night. So 4 o'clock in the morning and my phone is ringing and I'm getting the fax beeps, and you know once you get it once, you're going to get it at least 3 times.
And the faxes screeching in her ear are meant for a cardiology clinic whose number is very close to hers. She says she's been trying to get VHA to stop the calls for years.
They'll fix one situation and then somebody puts the wrong number into another machine and it starts all over again. But there's also the issue that there's important medical information that's trying to go from A to B and it's not getting there.
The calls are another example of the Vancouver Island Health Authority misdialing. An A News investigation uncovered faxes containing personal health information that had been sent to a Langford roofing contractor by mistake.
People needing CAT scans, prescriptions, pretty much anything medical.
Perrier says he's received more than 500 faxes over the past 10 years.
These are the documents that we obtained from Mr. Dan Perrier.
We returned the health records to the Vancouver Island Health Authority. VHA says it's taking the breach very seriously.
As we speak, my office is working with medical imaging as a starting place to look at all their specific workflows around faxing and to ensure that those are updated.
The health authority says it didn't know about the extent of the privacy breach until it learned of our investigation. It said it had been reviewing the way it handled faxes, but now it's stepping up that review.
Well, certainly the enhanced review clearly is a result of that. We do have fax guidelines that we use that have been supplied by the Information and Privacy Commissioner. We educate our staff quite frequently on safe and secure faxing, but we are a human system. We have human errors, and now that this has been brought to our attention, we're moving very, very quickly to try and improve the situation.
The Office of BC's Information and Privacy Commissioner is also investigating, but says it will not comment on the case.
Stephen Andrew joins us now in Studio A with more. Stephen, last night you told us that VHA said it had only received or uncovered one privacy breach. You've uncovered at least 6, and now the fax calls to a private home. Do we expect, or does VHA expect we'll find more?
Hudson VHA says it does. It says it sends out hundreds of faxes every day, and human error being what it is, the health authority would not be surprised if we received even more calls to our newsroom about privacy breaches. And if you have any information on privacy issues that you would like to share with us, we would certainly like to hear from you. We can be reached in our newsroom at 250-414-6510 or by email at islandnews@atv.ca. And Hudson obviously will be keeping a close eye on this story to see if any more faxes unfold over the coming days.
All right, we'll keep an eye open. Stephen, thank you.
You're welcome.